NHS bosses who silence whistleblowers face the sack under government plans. I'm going to read into this more from The Guardian, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from The Guardian with the headline that the NHS bosses who silence whistleblowers face the sack under government plans. Our ministers are to launch a public consultation on regulating managers in an effort to end a culture of cover-up in the NHS. Guys, while you're here, make sure you hit the like button and share this across social media so others are notified of this video. As some of you guys may or may not be aware, there's been a series of scandals within the National Healthcare Service over the last several years. There have been some absolutely horrific atrocities that have been caused, and there is a culture of some sorts taking place that has been taking place within the NHS, a cover-up, and this is really, really horrible. And while I understand that and I'm sure many of you understand that the NHS has been underfunded over the last 14 years. And obviously, investment is obviously needed to help boost the National Healthcare Service. There is also this there needs to be some sort of cleanup within it. Now, I would hope that this decision will obviously bring about a bit more assurances to people if there are problems within the NHS, if there are people who are misguided or misdevious, doing things that they shouldn't be doing, trying to hide the truth from things that the National Healthcare Service must take ownership and responsibility for. There have been a lot of cover-ups in the past, and its reputation has been questioned. The NHS is still very much loved by the United Kingdom. It's very much a loved National Healthcare Service. We love the system because we like to be able to go in, get whatever care that we need and go. That's always been the premise. We know that there are people in politics who want to change our system to an American-style system. We know that there are those who would rather we pay out of our own pocket than rather pay into the Treasury, so that the Treasury pays it rather than us paying it out of our own pockets. And I don't ever want that to change. I don't ever want that to change. I don't ever want to be in a situation where we're told we have to pay out of our own pockets for the healthcare that we provide. I don't ever want us to be in that situation. Healthcare is a human right, and a human right that we should all be entitled to. And we are very privileged to have a national healthcare service, which is why it's so important it must be protected. And if this culture of cover-up is dealt with and managers are regulated, then my hope is that not only does this end any kind of cover-ups that the NHS may try to do in the future, but their conduct will improve as well, and perhaps, hopefully, the performance of it does over time as well. We do know that there are shortages in some areas of the NHS, that is for sure. But I do hope this is the start of a good thing, rather than the start of something that perhaps could lead to more privatisation. I generally hope not, but we'll have to wait and see. So let's read more into this, you guys. So, NHS managers who silence whistleblowers or endanger patients through misconduct face being sacked and barred from working in the health service for life under radical government plans to regulate thousands of bosses for the first time. Ministers will begin a public consultation on Tuesday, seeking views on the proposals, which they say they are designed to eradicate a culture of cover-up in the NHS. It follows a series of scandals over the last decades at trusts including Morecambe Bay, East Kent, Shrewsbury and Telford. A statutory duty of candour, making NHS managers legally accountable for responding to concerns about patient safety, could also be introduced as part of the government's plans. Now, my fear is that while, of course, we need to hold managers to account, my fear is that that if it goes too, how far is going too far for managers? You know, where is the line? I mean, are we being too harsh, or like generally question in the comments? Are we being too harsh, or are we being too kind with this, or this is right? Do we need to be more stricter with NHS managers? I think that's a good question worth asking. Measures being considered including statutory barring mechanisms, similar to systems used for teachers, which could see health bosses who have been deemed to be unfit to practice appearing on a centrally held list. Tens of thousands of clinical and non-clinical managers work in the NHS, but there is no single framework to regulate them in the same way as there is for doctors and nurses. The consultation will run for 12 weeks, after which ministers will consider responses and set out the next steps. Karen Smith, a minister in the Department of Health and Social Care, said the proposals form part of the government's plan to end the revolving door that allows failing bosses to continue working for the NHS. To turn around our NHS, we need the best and brightest managing the health service, a culture of transparency to keep patients safe, and an end to the revolving door that allows failed managers to pick up a new NHS organisation, she said. Regulation would prevent the loophole that allows managers with a record of poor performances or misconduct to continue to work in the health service, government sources have said. Options being considered by the consultation include a voluntary accreditation register, statutory barring mechanisms, and a full statutory registration. Patients, health and care staff and professional bodies are also being asked for their views on whether to introduce a statutory duty of candour, which would make NHS managers legally accountable for responding to concerns about patient safety. At a minimum, all board-level directions in the NHS organisation in England, this is England, arms length body board-level directors and integrate care board members will be regulated under a new system, government sources have said. Amanda Pritchard, a chief executive of NHS England, said it was right that managers face the same level of accountability as other staff, but it was critical that regulation came alongside the necessary support to enable all managers to meet the high quality standards that we expect. The Deputy Chief Executive of NHS providers, Stefan Cogley, said the vast majority of NHS managers go to work every day determined to do their absolute best they can for patients. But where there is misconduct, it was absolutely right they should be held accountable for their actions. However, she also warned it was vital that regulation was fair and equable and proportionate. And this is my generally a little bit concern, is that it's very entirely possible that a misunderstanding or miscommunication or whatnot, and an NHS manager could be sacked for misconduct when it is found that it wasn't directly their fault. Yes, and it is I do feel this applies even more pressure on NHS managers than before as well. So that there is that as well. But yeah, this is the thing. I just want to make sure that it's as fair as it possibly can be for them to dispute them as well. Regulation must support a culture of openness so that we know is critical to delivering both consistently safe care. Crucially, regulation must be independent of both those being regulated and of politics, she added. The focus must be on accountability rather than blame and punishment, Labour's plans to formally regulate NHS managers were first revealed by The Guardian in June. In an interview at the time, West Street and the then Shadow Health Secretary said, I think the only way we can genuinely protect whistleblowers and create a culture of honesty and openness is if you have tough enforcement. I'm deadly serious when I say NHS managers who silence whistleblowers will be out and will never work in the NHS again. It is a number one priority for the system. Rachel Power, the chief executive of the Patient Association, a patient charity, said she welcomed the public consultation on proposals to regulate health service managers. Patients tell us accountability and transparency is often lacking in their healthcare journeys. We encourage everyone who has experienced NHS care, especially those who have felt unheard by the system, to contribute their views. There is a lot of work to be done in the NHS. Many different departments, and this is many different vital sections of the National Healthcare Service, and this is another one here. My hope is that obviously it does lead to better management, better control of the admin work, and that good managers, obviously, who can help and support the doctors in their work, can lead to a good team, which means can lead to the best possible care for our patients. People expect certain standards of our work, of the workforce in the NHS, and my hope is that this work over time proves that. Obviously, like I said, there are one or two caveats I'm concerned about some NHS managers, but overall I think this is a good thing, and my hope is that it proves to be efficient in the end of it all. That is one thing I do hope. But what do you guys honestly think? What do you guys make of these plans by West Streeting to those who are silencing whistleblowers are facing the sack under government plans. Do you think, whatever these proposals may be, will be strong enough? But will they also be fair and balanced? What are your thoughts on managers within the NHS themselves? Let me know your thoughts and more down in the comments section below. If you found this video informative, please hit the like button. We greatly appreciate it. Share it across social media so others are notified of this video. If you haven't subscribed already, please consider subscribing because it really does help support the channel. If you want to go one step further, financially support me and the work that I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching, and I hope to catch you all very, very soon.